that are here. I want to welcome everyone to City Hall. We're joined by, let me just thank you here from our council president in a minute, Miguel Melendez. I thought I saw Dr. Lamar, Dr. Sabrina Lamar, president, Monroe County legislator is here. I want to thank everyone for coming to City Hall. We're here because racism is a public health crisis. And, you know, someone said to me, they said, what do you mean by that? How is it a public health crisis? Let me give you some examples. And I'm going to give you one because I'm a father, married to an African-American woman. We are pretty well off, right? We're okay. We do okay. We can pay our bills every month. But did you know, for example, here's why it's a public health crisis. African-American women, for example. If you're an African-American woman, you have a higher chance of dying in childbirth, regardless of your income. You can make $10 million or you can make 10 cents. You have a greater chance of dying if you're an African-American woman. And your child has a higher chance of dying. Now, I'm a banker. I'll give you another example before I turn over the podium to Elder Hanif and the other speakers. I'm a banker. So, if you own a home and you're an African-American, you own a home, and you own the exact same home that a white person might own, same square footage, same color, same number of bathrooms. They've done studies on this. They've done exposés on this. If they go into my home, they may say, your house is worth $15,000 less or $20,000 less than the exact same home. And they've done this. And what they've done is they put a picture of a black family, right? And then they evaluate the home. And then they have the same people walk through that home, and they take the pictures down. And then the home all of a sudden is worth more than it was assessed before. And then my last example. You're an African-American male and you commit the same crime as a person of another race, a Caucasian, for example. Your chances of getting a longer sentence is totally different than someone else. If you're African-American and you live in a different zip code, your chances of having asthma or other health-related complications is higher. So these aren't things that we are just making up. These are things that are facts. They are realities that people who are African-American live with on a daily basis. These are things that are ingrained, and I don't care what anyone says. These are not things that we whine about. These are things that we are bringing attention to. So I want to thank Elder Hanif and all the members of the Black Agenda Group for recognizing that we have to have a commitment to health and public safety, and we have to call things for what they are. We can't sugarcoat it. We have to say that racism is a public health crisis, and the things that I mentioned are emblematic of the public crises that we have as a result of racism. So it's okay to have the conversation, right? It's uncomfortable. It's okay to be uncomfortable. It's okay. We have to call it for what it is. And the issue of health disparities, which my good friend Wade Norwood will talk about, is one that is causing death. These are life and death conversations that we are having. So we need to combine and join forces in our resources to create change. We need to take actions. That's how Rochester will grow. This will not just be idle talk and chatter. People are tired of idle talk and chatter. And before I turn it over to Mr. President of City Council, I'll tell you something a woman told me earlier this year. She said, what's going to be different in this community or in our country? She goes, I don't want any rhetoric. I want action. So it's one thing for us to say that racism is a public health crisis. It's another thing for us to do something about it. And I can tell you that the individuals standing behind me are all committed to doing something about it. I'm the mayor of the city of Rochester. I better do something about it. And if I don't, let me know. Here's the president of the Monroe County legislator. She's in a position to do something about it. President of the city council is in a position to do something about it. But not just us in government, but also those in the not-for-profit sector. All these folks that are up here are in a position to do something about it. And darn it, we are going to do something about it because our children demand and are reminders that we must do something about it, so I won't be reciting these same statistics 10 years from now. Now I will cede the podium to our distinguished council president, and then after that you'll hear from Elder Hanif Wahid, who will then introduce the other speakers of the program, and then I will come back out and close us out. So, Mr. President.
Thank you, Mayor. This is a very exciting day for me. I know that behind the scenes there's been a lot of work put together for this. City Council is committed in partnership with the mayor, but more importantly, in partnership with the community, to identify legislative actions and budget-related priorities to impact structural, systemic, institutional, and individualized racism. As Council President, I welcome the community's input on how we might attack these challenges head-on, what policies we might consider that address the 400-year-old pandemic that we have in this country, and what investments we might make as a city to reduce barriers for Black and brown or ethnically diverse communities. With that being said, the Black Agenda Group put together a declaration. Racism is a public health crisis. That statement included a pledge. It was about looking in the mirror. Whether you signed on personally or professionally through your organization, if you signed it, it should have meant something. Today, as the coalition forms to institute accountability measures, I am calling on my colleagues to join the Black Agenda Group in its efforts to first hold ourselves accountable and then to hold community institutions and organizations accountable. This pledge to fight systemic racism and the crises our communities face must be owned by all of us. To community members, if you signed, you committed to a cause greater than yourself. The Racism is a Public Health Crisis Coalition, and the tools announced today focus on accountability, transparency, and advocacy. While I know this is not the only effort underway, we have the Race Commission implementation to monitor and many other community efforts. This is a clear avenue for self-reflection and changing organizations and opportunities across the city from the inside. We must evaluate our own thinking around policies, practices, and procedures at the organization and individual level. I am honored and humbled to support this work, and I'm privileged to join the mayor in hosting this announcement at City Hall with on-the-ground leaders, advocates, CEOs, and representatives from diverse backgrounds. This is a proud moment. Thank you, Mayor.
Racism is a public health crisis, and this was established May 19th, 2020, with the name of God, the merciful benefactor, the merciful redeemer. Good afternoon, and thank you for your presence here today. To the Honorable Mayor Malik D. Evans, his administration, we want to thank you for arranging this joint press conference and having it here in this historical atrium where so many events have been held. To Council President Miguel Melendez for his true determination to make meaningful connections for his constituents and citizens of Rochester, thank you. To the Divine Nine, the inaugural coalition, which will be introduced later, thank you for all of your acumen and insights to form action to address racism as a public health crisis. Mayor Evans has been raised in this community, and you have watched many of us in this effort for equality for so many years. There has been the realization, and it has followed every mayor and city council member for the past 40 years, that there's a duality in the city. Prosperous for some, struggle for others. The elephant in the room is racism. And just like segregation became law and culture and wasn't removed until education disparities was the tool launched to eradicate it, racism is a public crisis which served the same aim of equity across the board in health disparities, and then followed up with tearing down structures in employment, housing, business, and education. May 19, 2020, the BAG launched the pledge, Racism is a Public Health Crisis, and since that, over 1,700 individuals, agencies, schools, businesses, colleges, universities, and medical centers have signed the pledge. We now are determined to go back and start a process of measuring the results and establishing communications to ask the question, where are we at now in our equity? To do that and to make accountability a reasoned outcome in all of this, an assessment must take place. And we realize it may be difficult to go back and just survey or ask that question, although we're not going to rule that out. We developed a tool that was used in another state called the assessment tool. And it works by asking the pointed question, where are you in your DEI? Have you started? Do you need assistance? And there's 3 stages of that implementation for each practice, which is 9. And the 3 stages are you currently implementing, planning to implement, or not planning to implement? And we'll share with you later what those 9 areas are. But through the assessment tool, we can contact each institution and make sure that they select an executive sponsor and a responsible staff person, experience, an internal cross-function team to complete this tool and to implement the select practices. The announcement today hopefully will create the response that will lift us up. And you can find the pledge and assessment tool on the Greater Rochester Black Agenda's website. Our next action was to form a coalition of minds, hearts, and spirits who have labored in the vineyards of fighting racism. Our natural senses made us look at us and our everyday lives, and we concluded that we are a coalition only if we declare it and act on it. So on October 15th, 2022, in the Hispanic Heritage Month, we launched what we affectionately call the Divine Nine, a group of individuals and agencies whose everyday life function around racism as a public health crisis. And before I introduce them, I would like to thank them publicly for taking this action on. Let me say that they are all stalwarts, talented, committed, and experienced in the history, challenge, and realities of racism. And there will be a lot of questions of how this group will function. Will other parties and signers be allowed to join or be a part of this? I will spare you all of those details today, but it's an emphatic yes. The Divine Nine are Angelica Perez Delgado from the Ibero-American Action League, Melanie Funchez from Ubuntu Village Works, Sharita Bullock, Healthy Baby Network, Dr. Myra Henry, YWCA, Dr. Chanel Hawkins, Urban League of Rochester, Dr. Janice Harbin, Jordan Health Center, Wade Norwood, Common Ground Health, Jerome Underwood, Action for a Better Community, and the Greater Rochester Black Agenda. Our next speaker is Wade Norwood.
Thank you, Elder. And friends, I'll be brief. I just want to, first of all, say how incredibly wonderful it is to be here and how grateful I am that the mayor and the city council president hosted us. As you all know, I spent a great deal of my life a long time ago in and out of this building. And in these early stages of our community coming into its new normal, to have this event talking about what's at the heart of our community in this place I love with these, my friends and family, means a great deal. Elder, Your Honor, thank you very much. Friends, I'd also note how those standing here with me and many who could not join us represent the best of how this community responded almost 2 years ago to the day when the world went sideways due to a deadly global pandemic. And it will be recorded by history, the way in which we rallied as a community to not only provide medical care, but to support businesses, to support families experiencing joblessness, to stave off evictions for those who were in danger, to make sure food got on the table, particularly over the summer to school children. And even though it may seem a small thing, to get thousands of play kits out to children in their homes so that we could protect childhood. A lot to be very, very proud of. But as we build this new normal, it is essential that we continue to remind ourselves that the reason why the coronavirus was able to be such an efficient discriminator, preying on the weak and the least among us, is because of the underlying health inequity that stubbornly persists, not just in this community, but across our nation. And those health inequities were exacerbated by the social and the economic inequity associated with crowded housing, with jobs where you had to be in person, with jobs that don't have robust benefits packages, in housing that doesn't allow for easy distancing or isolation. And those inequities still exist. For those who haven't read Common Ground Health's The Color of Health report, I encourage you to do so, easily accessible on our website. The facts are clear and they are indisputable. And my mantra for the past 2 years has been, a crisis is a terrible thing to waste. Let's not waste what's been a 2-year crisis. Let's tackle these inequities. Let us continue as we did in the ice storm and everybody extended those orange extension cords across the street to their neighbors. Let's start extending and spiritual and a committed extension cord to each other. Let us evolve what it means to be the city of Anthony and Douglas. And if we do this, my friends, we will be able to make sure that future generations come into this city hall, and as Mayor Evans just said, they find it not only not less, but better and more beautiful than was given to us. Thank you, Elder.
Next, we have Sharita Bullock, Healthy Baby Network.
I was also just asked to let you all know that there are paper copies, thank you, of the Color of Health report in the back of the room if you would like one. So I was asked to talk about the birthright, and I was really interested because when you begin to think about racism as a public health crisis, in order to claim a birthright, you must be alive. You can't claim it if you're not able to do so. So in CDC data that was released earlier this year, Black women are almost 3 times at risk of dying from maternal complications during pregnancy than their white counterparts. Our babies, unfortunately, don't fare much better. They are 3 to 4 times more likely to die than their white counterparts. And as we think about what that looks like on the whole, Black women represent 13% of the population of the U.S., but yet account for almost 1/3 of the deaths during the maternal period. And how dare we talk about mothers and babies absent of talking about men? So as we think about what is the cost and we talk about racial health disparities, what are the costs of our disparities? I'm here to share it's preventable death. Racism as a public health crisis, claiming a birthright. So we know that our healthcare system struggles to address racial health disparities, and most importantly, I dare say, to include the voices of family members and people from the community in those conversations. So in order for us to readjust and to prevent preventable death and premature death, we must work together collectively, those of us who are here standing before you, with those of you who are there with families. Because without their lived expertise and information about the experiences that they're going through, not yesterday, not 10 years ago, but right now, we will continue to send mothers home from the hospital without their babies. We'll send babies home from the hospital without their mothers. We'll send fathers home without their loved ones. And then we'll live with the consequences of how those families deal with premature death and loss. A baby who will never feel the touch of its mother. A mother who will forever mourn the death of her baby. So if we're going to claim a birthright, then that requires all of us working together in each of our lanes, doing the work that we need to be doing to embrace each other and really have not only difficult, but critical and crucial conversations to begin to address what are, and I'm here to tell you the bad news about this is that our racial health and birth disparities are growing. And the real shame about that is that Rochester is an internationally recognized city for all of our medical interventions and innovation. And yet we have the highest rates of death. And then preventable death. So I'm here to just simply remind you that in order for us to claim a birthright, and you can tell the health of a nation by how healthy their children are, and without our children, we don't have a future. So the call to action is for all of us to come together. Thank you.
Next is Angelica Perez Delgado.
Hello, everyone. I think it's a very exciting day today to come together with the coalition. I love the metaphor of the extension cord because definitely everybody behind me here was my extension cord at some point as we were trying to figure out how to respond to the needs of the local Latino community. Ibero has stood in the gap of equity for many, many years in this community. And I think similar to Sharika, imagine a world where no one understands what you're saying. And that is the experience that a large portion of our community experienced early in this pandemic. How do I get the services that I need when I do not speak the language? And organizations, are they positioned to be culturally responsive and respond to the needs of the Latino community? We're often not that far away from the poor health outcomes that our African American brothers and sisters share. And for this reason alone, I am so proud to be part of this coalition because with them together, we responded to the needs of the community that Ibero serves, and I'm very proud of that. This is the moment for everyone to look deep within, and you cannot do diversity, equity, and inclusion without language access. There's no such thing. If we can't even communicate, then there is no DEI. So I challenge every organization, especially those who serve our Latino community, to take a deep look inside, to be able to assess how do you hire more bilingual staff? How do you become more integrated in our neighborhoods and our community? We're very relational people, so you just can't show up. You have to earn trust, and you have to understand the cultural implications of how we live here in the United States of America. So I'm really excited because my partners have gone first, and they have modeled what that should look like, and I look forward to everyone else in our community doing the same. Thank you.
Next, Jerome Underwood, ABC.
Thank you, Elenife. Good afternoon, Mayor, City Council President. Thanks for letting us come in our own house. We appreciate that. The Mayor said something that I want to start with. At least I want to ad-lib to it. And what it is sometimes in order to comfort the afflicted, you have to afflict the comfortable. In order to afflict healing to people who have suffered so long, we have to do something maybe unusual. This coalition, we spent months talking about how do we do what we do. And we're very, very sober about the fact that racism is a public health crisis, and it has been so for a long, long time. So what are we going to do that's different? Several things. First is a commitment to ourselves as brothers and sisters to work collaboratively together, because when you look at who's here, I'm looking at Dr. Harbin, right? Jordan Health, a fixture in this community forever. Common Ground Health, data. Sharita just talked about the unacceptable morbidity and death for black and brown women. Angie, for me, there's no difference between black and brown. So what our Latino brothers and sisters face is the same thing that I face. And last but not least,